I just want to start by thanking everybody this evening for taking the time to discuss behavioral health needs that are within our community, the unmet needs that we've all observed over the last several decades, but certainly even more so over the last 2 years. If you could talk a little bit about what you're seeing in terms of the needs of patients today.
What stands out the most to me are adults in their mid 40s, 50s who are supporting adult children and then also supporting aging parents. So they were under significant distress and were struggling with insomnia, with increases in alcohol use. So we were really able to see that mind-body connection, and if the behavioral health needs aren't met, it has a significant impact on their physical health and being able to manage chronic illness.
I work on the front line, so to speak, so in the hospitals on the acute side, so ERs, through ICU. We're used to seeing, unfortunately, death and dying, but on this scale and without an outlet like we normally would do, you were socially isolated. That was the way to keep yourself safe, and yet that is also the way that a lot of us cope with these stresses. It's certainly the way that I cope with a hard day is having a girls' night out, and those things were removed. So you were sort of stuck in this conundrum of where's my outlet? How
has the last 2 years changed the dynamics or even the prevalence of what you're seeing? How is today different than if we just go back 2 years ago?
COVID, for me, what it brought to light that is good was not only the stigma around mental health, but the lack of resources around it. It suddenly was a realization of, well, wait a minute, maybe mental health is important.
Society, as you all so well articulated, has kind of awakened to this stigma. But people have a tendency to go back to their prior learnings. And so I see this window that's open, and I also have fear that if we don't make meaningful change within this opening, that we'll revert back to our overlearned habitual behavior. I think we'd be remiss to not just acknowledge that most patients coming in to seek behavioral health never see a behavioral health clinician at all. Patients come into our emergency departments with psychiatric needs, and they wait for hours and sometimes days in the emergency department. What do we do about it?
Without a behavioral health consultant on site, there's so many opportunities for these patients to go by the wayside, not because the primary care provider doesn't see the need. The primary care provider will then give them a list and say, here's some community resources. The question is, how updated is that list?
Right.
Has one of the providers stopped accepting X, Y, and Z insurance because the reimbursement rate's so poor?
What's great about Wellstar is we try to bridge that gap, going back to community. You see a bunch of dedicated folks who go above and beyond, who will reach out to everybody who's in the phone book and say, I have a patient, can you see this patient? Can you do your colleague a favor? Can you see this patient, right? And
we're doing crisis care right now, not health care. This is not my statement, but we see it all the time, and why not think ahead and mitigate the whole crisis?